Parents who don't want their kids vaccinated are finding ways around the California laws that require school children to be vaccinated. Now, SB 277 was passed into law in 2015 and removed the personal belief exemption for parents who chose not to have their children vaccinated. But since the law passed, the number of medical exemptions for immunization has actually gone up. Results of research just published in the Journal of American Medical Association suggests that parents opposed to vaccinations are finding doctors willing to give medical exemptions to students.
Now, the law came about after a measles outbreak that originated in Disneyland and infected 159 people. Low vaccination rates are believed to have made the outbreak even worse. So joining us now to discuss vaccination for children is pediatrician Dr. Lauren Crosby, and you've been practicing medicine for 20 years.
That's true.
You've already seen this come through your office, parents saying, I don't want vaccines or my kid to be vaccinated. However, the law requires them to go get these vaccinations if they want to enter school. They have to get it.
They have to. As of a little over a year ago, it is required. So in our practice, we actually don't have unvaccinated families. We've always held the philosophy and held up the American Academy of Pediatrics guidelines, which are you get your vaccines. So the families who come to us know that, and they appreciate that they're coming into a all-vaccine practice.
But people are still coming in now and saying, I need them, even though school's already started.
Right, but there were people who would ask, or they would get into the practice and then have their own schedule, how they would want to follow it. But now even those people have had to ramp it up. And so I think that this has been excellent, because we have seen people come in and be like, we're starting school in 2 weeks and they won't let my kid in, and we understand now we got to do it. And they also understand that some of the things that were really dissuading them before have been disproven, and they understand that this is a health concern.
Let's take a look at the list of vaccines that children are required to have when entering school, and not only public schools now, but private schools. Under law, you're required to have these vaccinations, and you're looking at that list right there.
Yes. Those are all the ones you want. So the DTP, that's the diphtheria, tetanus, and pertussis. Pertussis is whooping cough. So in 2010, California had an epidemic. They had an outbreak, and 10 infants died, infants that are too young to be vaccinated. So pertussis comes around. These things come around if you don't vaccinate. Polio, the measles.
Yeah, the list goes on, but we should mention that personal belief is no longer a reason or excuse for kids not to have these.
Right, so that was a great thing about this law, is you have to have a real medical condition, and a doctor, a licensed physician, has to actually write a statement excusing your child.
But here's the thing, you say that, and is it as simple as I'm sick or whatever, and just getting a doctor who's willing to do it? It's a doctor's note, really, essentially, because is it that simple for someone to just get a doctor's note and say, my kid can't have this? I
hope not, but I think that that is what's happening, and what they showed in the study was that the medical exemption rate has tripled. So from 0.17 to 0.5, it has gone up, even though the personal belief, of course, went down because of the law. So I think some of those may have been kids who may have even had real medical exemptions, and the parents were writing a note because it wasn't strict and no one was checking. And I think some of these are that they're finding physicians who either are loosely interpreting this law, or there are websites for doctors who you can pay them and have a visit and get a medical exemption note, because there aren't any real strict criteria yet. It's not, there's no real list. Medical board is not checking.
Which poses a danger to kids.
It absolutely does. So we need to do this. It's a public health concern. It's for safety. It's for those who can't get vaccinated. If people really want to help people and help their community, keep everyone vaccinated and protect those who can't.
We'll have to leave it at that. Thanks so much, Dr. Lauren Crosby. As usual, we appreciate it. Great to see you.
Thanks.
We'll be back.